But my why really is rooted in the fact that I strongly believe that every community in the country deserves to have a high quality community hospital that serves their needs. Your zip code should not determine if you're able to receive the right care as a mother.
The TikTok comments that we get, the feedback from the general public is really, really rough on healthcare administrators.
There are dozens and dozens and dozens of hospitals and healthcare organizations that we have had multiple conversations with over the years. And I watch their compensation ratios increase. I watch their finances deteriorate. I watch the headlines get worse and worse and worse. And we continue with conversations. But the one thing that never happened, things that we're really not focused on, is how many early careerists and first-year nurses leave our profession. It can be anywhere from there's going to be a 20,000 person nursing shortage or 100,000 nursing shortage. Crozer Health and everything that happened at Crozer Chester Medical Center and Taylor Hospital. It's private equity, is brought in with profits in mind and profit over patients, and extracts out $490 million of money that literally, if you think about it, is funded through federal government dollars for Medicare, Medicaid, taxpayer dollars.
Yeah.
It's lining pockets of individuals that, took out $89 million of equity paybacks. It took out all this. And then ultimately, the hospital closes its doors. You have profound consequences. And
Hey everyone, welcome back to Humans of Healthcare. We're joined today by Stephanie Dorwart. She's somebody I met through Ann Richardson, and just kind of getting to know each other over the past few days more than we got a chance to know each other over the past few months. But we kind of do this thing now where we bring folks in for dinner the night before. And it's been a wonderful little way to get to know people. So thank you for being here. It's awesome to have you. We've had so many great conversations already. I can't wait to just kind of put this on video for everybody else to see what we've been talking about. But it's so cool when we get to this point and you and I have kind of talked about some of the things we're going to mention here today. And I feel like we could just keep going on and on for, hours and hours talking about these topics. We'll try to get it done with it like in an hour or so today. But man, this is fun stuff talking to you. So thanks for being here.
thank you so much, Danny. It's a pleasure to be here, and I'm really looking forward to the conversation today. We're going to share a lot of good information and provide a lot of value.
Yeah, that's awesome. So would you mind just kind of starting and telling us about yourself? Like when I say that, we like to know where people have come from. You can go back as far as you like, but like where you're from, kind of who you are. You mentioned something about your family coming in from Germany and Ellis Island and how your name got to be your name. I think, you don't have to go that far back, but, start at some point and kind of tell us about you.
Well, absolutely. And since you did mention Ellis Island, I'll just share a little bit of quick background on that. Family came over from Germany, and whenever they were entering into Ellis Island, the original name was Dorwart.
Star Wars.
Dorwart,
Oh,
Thol.
Dorwart. Yeah, DH, yeah.
And it ultimately, the TH got dropped for a D,
Yeah.
and the worth became a wart. And the name Dorwart did not fare very well in elementary school, but it is what it is.
Oh, yeah. See, we were just saying that, like, those folks at Ellis Island had so much power, they just changed people's names, they could do whatever they wanted to do. You're just kind of glad your family was, I'm sure, just glad to be in the US.
They were so happy to be in the US. But to go back a little bit more, my professional career, I actually have a non-traditional pathway to healthcare, which I think is really important and interesting to share.
Sure, yeah.
But my first career in love was mathematics and statistics. However, growing up as, a little child, I always had the stethoscope around my neck. And so I would either do two things whenever family members came over. I was either teaching them math, or I was taking their pulse and taking their heartbeat. So always was interested in being a pediatrician, but also had that passion for teaching. Initially went mathematics, statistics, and ended up taught high school at my local high school for several years, which was very interesting. I had the blessing to actually teach side by side with my mother for
Cool.
which was a very, very interesting experience. I'm very grateful.
Yeah.
But there came a point in time where I kept feeling drawn to do something different.
Sure.
And I felt as if there was something else out there. So I started looking for opportunities. Was I going to be a guidance counselor? Was I going to be a principal? Was I going to be a superintendent? Was I going to go back to school and earn a master's degree in something else?
Sure.
And I ultimately had a mentor and a friend of the family that started to kind of plant little seeds in my mind and talk about the fact that there's really not a lot of data in healthcare. And with your statistics background and mathematics, you could probably do some really interesting things.
Cool.
And then you plant the next seed. Have you ever considered going back to get your Master's of Health Administration? Plant the next seed. There aren't any benchmarks right now in healthcare. We're talking about the 90s. It's like we don't really have any data to use. Have you ever thought about diving into that? And so ultimately, over a series of conversations and years, I decided that that was the path that I wanted to pursue. Went back and got my Master's of Health Administration and was blessed to have a series of events that happened that really drove me to productivity. A lot of people say, what made you focus on workforce optimization, staffing and effectiveness, and productivity? And I often say it chose me.
Wow.
And I say it chose me because my first opportunity working for a hospital was on the tail end of a very, I'd say, emotional layoff for that organization.
Yep.
I started on a Monday. They had laid off some individuals a couple weeks prior to that. And so it started with a report being dropped on my desk with a bunch of benchmarks. And my first job was reverse engineer that report. And then I was told basically that they wanted to understand the metrics so that they would find themselves in a better position in the future.
Cool.
So I started working with the nurse leaders. I started getting into the trenches. I started really focusing on the front lines and identifying what could we do differently?
Sure.
What's working? What's not working? And I still have a journal at home that on one side has all the things that were going well, all the great things about vendors, all the positive things about the consulting firms that organization was working with. And on the other side, I have all the negative things.
Pros and cons list.
Pros and cons list. And ultimately, Danny, that became the evolution of ALTIUS Healthcare Consulting Group, my productivity practice, and what we do today.
Cool. So you started actually working as a hospital employee. Did they hire you as an FTE W-2?
Yes, I was a hospital employee, hired as a W-2. I started at that facility actually as an academic resident. So what a lot of organizations, they have administrative fellowships.
Sure.
I had the blessing of, having an administrative fellowship where I was able to work in each individual department.
Nice.
And so I did all of the standard things like work in the laboratory on the night shift, gown up and work in the operating room to focus on reducing turnover time and all these things.
Really important stuff. So I remember working in Oklahoma when I was coming up in healthcare, and there's an organization called Hillcrest at the time that had this this program for administrators where they had rural hospitals too, and they would hire these folks that were pretty well straight out of school and then put them as CEO or COO in a small hospital in their system, and they would groom them. And then eventually those people would move up. I know one of them, his name's Xavier. He was at a small town called Poto, Oklahoma as a CEO when I met him 20 years ago. He's now the CEO of Hillcrest, right? So he stayed in the program, left, came back, but now it's just like, it feels like those roots were really strong when those organizations have those programs like that, to attract and retain talent. Seems like a pretty savvy way to get people in and keep them loyal to an organization.
It is a great way to retain talent. It's also a great way for us to mentor and really, turn new grads into strong leaders.
Yeah.
And I'm very closely affiliated still with my, MHA program at the University of Pittsburgh, as well as, ACHE, American College of Healthcare Executives. And I have countless examples of similar stories like you just shared, where individuals go into the residencies, they're then appointed as the CEO or COO. They move up into a stronger, larger facility.
Yeah.
And step by step, they ultimately end up as the CEO of the hospital.
Yeah. Yeah. So, like, I asked this of a lot of people because we're fortunate to have a lot on the program. What drew you to entrepreneurship?
What drew me to entrepreneurship? Well, ultimately, I wanted to make a big difference. And I noticed the opportunity to really transform the way that organizations think about productivity, the way that organizations think about workforce optimization, the way benchmarks are developed, the way benchmarks are reported, the way we teach that information. And ultimately, I knew I wouldn't be able to necessarily do that working for another organization.
Sure.
They might have their standard way of they develop their benchmarks, their operations, their tools, their metrics. And I wanted to actually completely realign the way we look at productivity, because productivity has been weaponized a lot in our industry, in healthcare, as it probably has in many industries.
Yeah.
And I wanted to make sure that I could put that positive impact on it because productivity is going to produce positive results
Sure, sure, of course.
because it shines a light on processes that can be improved. It shines a light on areas of access improvement. But productivity can't produce positive results when there's negativity, when there's a toxic culture, when there's misalignment, when there's fragmentation, when there are issues. So ultimately, I was drawn to entrepreneurship because I wanted to solve those problems.
Yeah, yeah. It's like the same reasons, like for me, like I wanted to solve problems. I wanted to kind of look at things a different way. And it felt like couldn't do that where I was working for somebody else in their vision. And not that there were bad visions out there, it just wasn't mine, you know? So it sounds like you're kind of similar where you had this idea and the only way you could really go execute on that idea was to do it on your own and, build a company around you and stuff like that. So I appreciate that. Yeah.
Entrepreneurialism gives you freedom.
Yeah. Yeah. Totally.
It gives you the freedom to choose and select how you do things.
Yeah.
And a part of the history that I probably did not mention is ultimately I was recruited into a consulting company to build out the productivity service line for them.
Okay.
And so my first entrepreneurship entry level was within that consulting company.
Wow.
When that founder retired, I actually purchased that company
Oh, cool.
and then continued on the journey. So
Cool.
I did develop my own product within that former company, but then I actually purchased that company to continue to serve the clients that we had and do what we're doing.
That's awesome. No, I didn't know that. Okay, so, so yeah, you took that path of acquiring an organization that was already developed. So, you mind telling me a little history about the organization? Like, I'm always curious for some reason about the name. Like, what does it mean? And then, kind of what you're. I'm intrigued about you, but I also big part of us is our vision, as entrepreneurs. So I'd love to hear kind of like, the why is kind of cliche, but like, what's your vision? Like, how did you come to your name? Like, what are you most excited about with what you guys are doing?
Great question. Let me start with the why a little bit because I think that's really important
Yeah. Yeah.
to share, especially with some of the things we're going to talk about on today's podcast.
Yeah.
But my why really is rooted in the fact that I strongly believe that every community in the country deserves to have a high quality community hospital that serves their needs. And everyone should have access to care. Your zip code should not determine if you're able to receive the right care as a mother. The zip code should not determine whether your father can actually get access to heart attack care whenever they need it. Your zip code should not determine that. So I strongly believe every community should have a strong hospital to support them.
Right.
That's one of the missions for ALTIUS is we want to provide the highest quality care, the lowest possible cost with an engaged staff. Now, where did the name come from? Well, after several strategy sessions of jotting down names and airports and looking at all types of iterations and things, landed on the name ALTIUS because ALTIUS means peak
Okay.
in Latin.
Okay.
So the evolution of where did ALTIUS Healthcare Consulting Group come from really is we build that culture of excellence and we want to drive our hospital organizations to the peak of performance and really build championship teams.
Okay.
And what is a championship team? Well, a championship team is a team that's always looking to get better. A championship team is a team that has teamwork. A championship team that understands where their performance levels are and where they have opportunities to grow. And ALTIUS really strives for doing that for all of our clients. It's driving up that mountain one step at a time, reaching the peak performance that's possible.
Okay. Very good. So you take their hand and hold them through that process. It sounds like you get to know them. You and I talked a little bit about this, and I think we share a passion for it, which is getting into the weeds and finding out what they're doing currently. I think we both call it an assessment to determine like where they're at to get that baseline understanding. But then once you have that foundation, then you can kind of know how to help them. But that's such an important part. Sounds like you actually like doing that stuff.
I love the assessment process and enjoy the conversations with each and every leader that we with. Everyone has something different that makes them who they are and brings different life experiences to the table. And every hospital has a different culture and every department leader has different philosophies and different metrics and different reasons that they ultimately got into healthcare, but we're all grounded in one commonality. And that's usually a mission to want to make a difference. And when we're all grounded in that mission to want to make a difference, the conversations that you have are so fascinating and interesting. I just love learning what makes people tick, why they're in the department that they're in, what they want to do, and then ultimately, what are their goals? What do they want to do to make a difference? But that assessment process is so fun.
Yes.
and just learning everything about the operating room. How many rooms do they have? What are the different surgeon mentalities? What are the cases that they're doing? How long do they take? What's the duration that their cases take versus the industry average?
Oh yeah.
What's their first case start times? And all of those pieces are so just fascinating, but it all plays into the outcomes.
Yeah, it's really fun. I hope that people watching can understand like the passion that we feel for this stuff. It's our puzzle, and it's there's a lot of different puzzles, and you kind of don't know how the puzzle is going to look, but you're going out and finding the pieces and bringing them in, and then you get to put it all together. I think that's one of the fun parts about this is, and the more data you have, the more relationships you have throughout that process, the better the outcomes, But it's like from my vantage point, the relationship building during that process has been one of the most valuable aspects of doing an assessment and having a long-standing relationship with anybody in healthcare. Once they earn your, or yeah, once you earn their trust, and frankly, once they earn your trust, because it's a reciprocal thing. Like we're there to help them, yes, but the more they open up, the more vulnerable they get with us, the more transparent they get with us, the more we're able to actually help them. And if they trust us enough to do those things, that's where the magic is. That's where that feeling happens to me. Yeah.
Yeah, when you build the relationship and you start with connection and you build that foundation of trust, that's when you can make a true difference.
Yeah.
Because, leaders will open up about what are their challenges, what are their obstacles, what's keeping them up at night,
Yep.
what do they need to overcome. And as you mentioned, you're starting out, you have all the pieces on the puzzle board, but ultimately we're typically called in because something's broken.
Yeah.
Whether there's a high turnover rate, where there's a lack of retention, they're bleeding margin, they're, really struggling. We're typically called because something's not working right.
Right.
Might be a gap in productivity targets.
Sure.
But the goal is you have all these pieces on the puzzle,
Yeah.
and listening to those individual assessments and interviews with each of the leaders allows you to start to form the solution. This is this puzzle pieces coming together.
Yeah.
It's ultimately going to move that hospital forward, but move it forward with a common strategy.
Yeah.
And everyone working in alignment.
Yeah. Like in my business today, one of the things that I wish I had a lot of was somebody that would know where to take me. There's so many circumstances that I get into. I'll preface, I'm a new entrepreneur, a year and a half in, really, a new CEO, and there's so many circumstances, if I'm honest, that I'm not good with yet, and I struggle to find somebody that can actually help me navigate the choices that I have to make, and have somebody by my side that's taking the time to earn my trust. And yeah, I know I'd be paying for it, but I'm okay with that as long as I trusted the person that was there to help me when I needed them, and knows what we're going towards based off of what I said to them. That feels like something that if you should bottle up and sell, which is something that you've done. But for me, it's just like a relief.
It is a relief. And I think we all, have different points where we need mentors and coaches and guides, if you will,
Yeah.
because none of us have the answer to everything.
No.
So we need to, really embrace that working with a coach or a guide and getting that support. And it does give you peace of mind because you have someone to bounce the ideas off of. As an entrepreneur, I also, rely on mentors and coaches and, different relationships to build that.
Yeah.
And I had one, once that gave me very sound advice on consulting and, on this, I think it might be really relevant. The fact that when you're looking for outside expertise or you're looking for outside consultants or you're looking for an assessment or even for you,
Yeah.
looking for someone to help with the entrepreneurial spirit, you only hire outside expertise for 3 reasons. One, because that person has knowledge, has experience, has answers that you don't. 2, they have time that can help you accelerate. So maybe they're able to come in and help you get things done faster.
Yeah.
And can actually build it. Or 3, they can deliver a message that you can't. And the third really is something I think sometimes is undervalued when you're looking at outside consulting, you're looking at assessments, you're looking at those relationships, because many times a senior leadership team or CEO, COO, nurse leader, they may know what they need to do,
Mhm.
but they're not in the position to communicate the message in a way that's actually going to move the needle forward.
Sure, sure. So like past behaviors could have led to a point. Like there's all sorts of things that can get them into a trap, right? To where they're not the right person to deliver the right message. And it's hard enough to get the right message, but if you botch the delivery of that message, it sounds like you're going to be in some pretty hot water. And have some recovery you're going to have to do.
Exactly. And ultimately, they're going to remain with that organization. Yeah, their intention is to take the organization from where they currently are and to improve upon that performance level. So they want to not lose any of that relationship building that they have and burn bridges. But, they can actually accelerate that by having an outside entity share what's happening in the world, what are we seeing, and then ultimately share what they need to do.
Yeah, yeah.
And consultants aren't coming in necessarily to only point out what's not working or to show all of the dirty laundry, so to speak.
Sure.
They're also coming in to show what's working well and identify where do we need to improve?
Yeah.
Where can we do differently?
Yeah. Yeah. No, you're right. It's a healthy mix. If I'm on that side of the table, I want the affirmation too. I don't just want the stuff I'm doing wrong. It's just because choices are, I mean, they're tough, and sometimes you're right. I just don't have time. I don't have time to evaluate them the way that I need to. And I'm a who, not how guy anyway, but I learned that from a mentor. So, like I don't have to dive into the how I can trust people. But there's a lot of folks that, on a part of our conversation last night, it's hard to trust.
It
It's hard to
is.
ask for help.
It is hard to trust. And going through multiple projects like this, once that trust is built,
Yeah.
you can really make a lot of progress, but it does take time. And it's a very interesting thing. One of the areas that we work with often are when new leaders come into organizations.
Yeah.
So, fresh CEO coming into a hospital or a new CFO, and we're often engaged because the leadership teams, the directors, the managers, those will build trust with us and share stories with us
Mhm.
that really helps that new CEO or new CFO understand the dynamics of the team they're working with
Sure.
and accelerate the performance and ability to improve.
Yeah. Yeah.
So it's the approach that makes all the difference. And those conversations, when you care and people know you care,
Yeah.
can do amazing things.
Yeah, totally. So one of the questions that we were going to have today, and I'm going to bosh the question. I can actually read it, but I'm not going to. Um, when I think about the humans behind these administrative roles, the healthcare leaders, right? Um, I'll tell you, I feel like they're like you and me. They're good-hearted. They're there for the right reasons. They're scared in some cases. They have fears. They don't know all the answers, but they tick like we do, and I don't know, they're warm-blooded human beings, and so like on the TikTok comments that we get, the feedback from the general public is really, really rough on healthcare administrators. And that's why I started this podcast to begin with, was to help healthcare executives, right? So I might get ridiculed for that out in the big world, but the truth is, like, I know these people to be really good people. And so, like, I think it is important to ask the question the right way, frankly, because I want to I want to hit on this one. It's kind of in the middle of the questions that we had. What's something about hospital administration that through your consulting you found would surprise or even shock frontline healthcare workers?
I think something that would really surprise and shock healthcare workers and frontline workers is to know that the C-suite, the senior level leaders, are concerned and worried and staying up at night thinking about the exact same problems that they're thinking about. Right? The true shock is that they are also humans of healthcare.
Yeah.
So I think the big shock is that, the leaders in the C-suite also want to do the right thing. They're worrying just much about staffing burnout and the lack of equipment and the financial stresses and the fact that they aren't able to get patients in just as much as the frontline is.
Yeah.
So they're losing sleep at night over the same concerns.
Yeah.
And I think ultimately that's the big shock because there is a perception right now, especially due to a lot of the press that's out there, that there's a disconnect, with the C-suite and that there's not enough caring or empathy. And the reality is, with the leaders that I meet and the individuals, they care a lot.
Yeah.
And they want the hospital to be successful. They want their frontline workers to be cared for and taken care of. They want the patients to be cared for.
Sure.
So there's an alignment between that, but they're stressed out as well.
Yeah.
And, they're running from meeting to meeting to meeting, often dealing with competing priorities and competing pressures, but they care just as much
Yeah.
as the frontline workers do. And I think the shock is ultimately everyone wants the same outcomes.
Yeah. It's funny. That's a great answer. I agree. I think the shock is that they're humans. And, as I think about what keeps me up at night, it is the competing priorities. And I always say that that has a power to it. When you have competing priorities, that means that you hear people and you're empathetic to the people that you're hearing from, especially the department managers and those folks that are in the boardroom with you and, part of these decisions. But you can't always go with their idea, and that weighs heavy on me. Well, I have good ideas coming from people and I can't say yes. I only feel like I get a couple of no's with people. I always feel I don't know if that's true or not, but that's the way I always feel. So I want to use those no's sparingly. And so sometimes it's not that I don't hear you, I guess. It's that I just I can't really say yes and I don't want to say no. It's a weird place to be in.
It is a very weird place to be in. And frontline workers and workers in general, they want to be seen. They want to be heard. They want to know that you're listening to them. They want to know that you're paying attention to what their needs are and doing something about it. However, you're not going to be able to address or make every single decision or address every single need. It's what needs to happen then is the communication
Yeah, yeah,
back to about what you are doing,
yeah,
and the trust is developed through that, but also why you might not be able to do something
yeah,
and being authentic and being real about that, but knowing that they were heard, that you saw them, you listened to the request and the need, and that you're then going to address what you can.
yeah.
And by having that relationship and the communication and then reporting that back, that builds trust.
It does.
And you cannot do anything in any organization unless you have trust.
Yeah, I think you're spot on. I mean, Ann Richardson, our friend, talked about the same thing the same way, and her strategy as an administrator was to get out there and build relationships out there in their world, not behind a desk, not in an office, stowed away. But there was one surgeon that told her that I can take a no from you because when you say no to me, you explain it in a way to where I know you've thought about it. I know you cared about it. And so I'm okay with no from you. I mean, to me, it's a high compliment when that happens, but she described like you as like, as an administrator, you got to model this behavior and this discipline, like eating your vegetables. You got to go do this stuff. And if you really enjoy it, it's all the better, to be out there talking to people.
That is a huge compliment.
Yeah.
And that is definitely the way to model it and to be talking about it and to being authentic and to being real. And, there's a lot of talk right now about making sure that you're leading from the front.
Yeah.
And the question is, well, what does leading from the front mean? Well, it means that you're not behind closed doors hiding in your office.
Yeah.
It means that you are rounding on the patient units on the floor within your organization, that you're visible, that you're listening.
Yeah.
And when you're listening, and as Anne mentioned, the team is responding and sharing what you need to do,
Yeah.
you need to hear it
Yeah.
and then make a decision to do something about it. One of the biggest ways that I see that trust can be eroded is when leadership teams round and they have great intentions and they're doing the right things, they're listening with empathy, they're really interested in the rounding, and they commit to things during those rounding tours
Sure.
and don't follow through.
Yeah.
You will erode trust so quickly if you commit to something that you may intend to do at the time,
Yeah.
but then for whatever reason, you can't follow through on it and you failed to go back
Yeah.
and explain why it didn't happen.
Sure.
So if you're going to lead from the front, which you absolutely need to do, you need to be visible and seen and approachable.
Yeah.
You want to also follow through. So don't commit to things that you cannot follow through on. And so I also got a lot of leaders and coach them to don't say yes automatically.
Right. All right.
Say, I really appreciate and hear what you're saying. That's a great idea. Let me go back and think about it and process and understand what we might be able to do.
Sure.
And I'll report back. And then make sure
Sure.
you report back.
Oh yeah. Great. Yeah. The follow-up's important. Like I think about, one of the things that I am challenged with in my career I'm getting better is candor, and how important it is because kindness comes easy for me. But it's when you add that mix of candor in, because I don't want to be kind to people, mislead them, and then make them think that everything is great when actually I'm harboring some idea that there could be something better about their performance or the situation. And I'm not sharing that, I'm not being vulnerable or open when I'm not being candid, I guess. Right.
Yep. Candid's definitely important. And I've learned that you can be kind while communicating difficult messages.
Sure.
There's a big difference between being kind and being nice.
Yeah.
And so you can be kind by communicating those difficult messages, especially if someone's underperforming or the team's not performing.
Yeah.
in a kind way, but also communicating this performance level isn't going to, be what we can support going forward.
Sure.
And being basically
Yeah.
kind about what the expectations are.
Yeah. I think
And
that's,
candor is a big part of that.
yeah, no, I completely agree. It's showing up in all these amazing ways for me. So, I'm going to go to the next question and kind of um, one second. I got to find the question now. Wait a minute. Edit this part out. Okay. So, all right. So, from your perspective, what's the number one internal challenge hospitals and health systems are facing today?
So I've thought a lot about this, and I would say that it's fragmentation and silos.
Okay.
The number one challenge really is that you have a lot of different departments and a lot of different priorities. And some cases, a lot of different strategic plans and a lot of different electronic medical records.
Yeah.
But there's fragmentation and silos and a misalignment. So really the biggest challenge that I see an opportunity is to create alignment. And what does that mean? And where are you looking for alignment? Well, you need to have alignment between your strategic plan and your budget. And the strategic plan cannot just be a book that sits on the desk because in today's world, strategies are changing so quickly. Danny, I mean,
Sure.
you turn around and the plans are irrelevant. So that strategic plan needs to evolve.
Yeah.
But then you also have to take it a step further and create that alignment between the organization's strategic plan and the department level strategic plan,
Right.
which then becomes each department leader, each individual becomes a CEO of their area. They have their own individual strategic plan for their department and understands how it links to the mission, vision, and values of the hospital, the healthcare system. They also have their own KPIs and their own playbook, and they understand how that playbook is going to play into the overall culture of excellence for the hospital. So ultimately, the department leader needs to know their own plays. What am I doing today? What plays am I making? What's going to move the ball down the field?
Yeah.
And then those plays align with everything. So there's that misalignment. You have a lot of people moving in different directions. You have providers, you have the frontline staff, you have the C-suite, you have the board.
Yeah.
The magic really happens when all those fragmented pieces come together under a consistent message, moving in the same direction, rowing together and working towards the same thing without pointing fingers at each other, without getting mired in what I call the negative C's, which are the cynicism, the complaining, the criticism.
Right.
And they really start to focus on the C's that are going to move you forward: clarity of vision, communication of direction, and focusing in on those C's that are going to make a difference instead of the C's that are going to undermine you. I think Stephen Covey was the first one that pointed out the 6 C's that can destroy any organization.
Yeah. No, that's a great answer. So from my vantage point, I wonder, how do you like practically get the time to do this stuff when, when you're in hospitals, like the world is always, reactive to what's been put in front of you. How do you see hospitals get the time to think about and engage and do what they need to do based off what you just said? Fully agree. I think that's the right answer. Clarity to me is always a big one, but like, how do they do this? How do they practically do the time or get the time for this?
Well, first off, you have to free up the white space, so to speak, or the calendar time to actually think.
Yeah.
And that thinking needs to be there for the individual leaders as well as the C-suite and the senior leadership team altogether. And what I'm recommending is not necessarily just another meeting that goes on the calendar, because as you all know, C-suite executives are probably in meetings from the front of the day towards the end, even directors from 7 a.m. until 7 p.m. And they probably don't have the white space on the calendar, but you have to create it. You have to actually create that space to think and work together on what those goals should be. What is that philosophy? What should we be working towards? And the way you do that is remove the meetings that you may not really need to be involved in. A lot of times we CC people and we like to invite every single person that might be interested in that meeting. But really the only people that should be in that meeting are the people that are going to influence the outcome and that are directly involved in the decision. After that decision is made, you communicate it down, but you don't need 25 people
Yeah.
that are in that meeting if they're not decision makers.
Sure.
So free up the calendar, have only the necessary people in the meetings that need to be in the meetings, which then ultimately is going to give everyone more space to actually focus on what matters.
Yeah.
Because, I say this all the time. I think I said it to you earlier today, is planning is where productivity, where performance, where improvement goes to die.
Yeah.
Because planning, if we stay in the planning phase, ultimately we're never creating.
Yeah.
We're not acting. And if we never make that decision to act, nothing's going to change.
Yeah.
We're going to just keep talking and planning and looking at more data and looking at benchmarks again and identifying and doing yet another assessment and getting more recommendations and talking about it and planning and not acting.
Is there something comfortable about the planning for people? Like I'm as you're talking, I'm like thinking about what I'm going through right now with, we're in the launch, of a product. And um I don't know why, but when you said that, I just triggered that for some reason I'm more comfortable in planning than I am in pressing the action button.
There's actually a lot of psychology and a lot of reasons that there is a tendency to stay in the planning phase.
Okay.
First, as long as you're planning, there's no risk of failure because you're not acting.
Yeah.
And until you act, you don't risk failing. You don't risk making the wrong decision. You're not risking moving forward with something that you may have to pivot on and change and identify. So you're planning, but not risking failure. And the reality is, the only way you're going to move forward is to fail because you actually have to test your philosophies and test the planning and test the decisions to see, is this going to work? So you have to get out there and try it. And if it fails, it's okay. You can pivot and you can change, but if you don't act, you're never going to be able to achieve. So we actually take our clients through a 3-step philosophy in everything that we do that starts with acting. You have to act. I can tell you actually I don't know the actual number, but there are dozens and dozens and dozens of hospitals and healthcare organizations that we have had multiple conversations with over the years. And I watch their compensation ratios increase. I watch their finances deteriorate. I watch the headlines get worse and worse and worse. And we continue with conversations. But the one thing that never happened, they never acted.
Yeah.
It's not the right time.
Yeah.
We'll circle back to this. Our team has too many competing priorities. We can't look at this right now. We can't stress people out with one more decision. But you're never going to move forward if you don't act. And once you act, you have the permission to change. You don't have to stay committed to that action. It's not working.
Yeah.
But you can adjust, but you have to take that step forward. If you know that there's misalignment between your volume and your nursing staff, you're not hitting the appropriate nurse to patient ratios, you have to act to make a change.
Yeah.
Because if you don't, nothing's going to change. But once you act, you can accelerate. And how do you accelerate once you act? Slow and steady, small improvements. You celebrate the small wins. When you make a change to a shift and it has a positive outcome, the staff's less burned out, there's better quality, whatever it is, you celebrate it, acknowledge it. You're the leader that's visible, rocking, rounding on the units and recognizing it.
Yeah.
And when something doesn't work, you're also brave enough to say, hey, we need to change and it's okay, but that accelerates.
Yeah.
And when you get that acceleration, you build that momentum, you achieve.
Yeah.
And, if you think about going back to championship teams, and I reference championship teams a lot that have won Super Bowls, Stanley Cups,
Yeah.
World Series, whatever, your favorite sport is or analogy is, championship teams are never satisfied.
Nope.
Great players, great leaders are always in growth mode.
Yeah.
They're wanting to get better. And so when do you stagnate? You stagnate when it's in mediocrity. You're not growing. You're not changing. And all you're doing is planning.
Yeah, that's a great one. So in that theory, failure is better than planning. Good, because you're taking action.
Yes.
If you brought those two things up, what would I rather do? I've thought about this a lot. It comes up a lot. I'd rather go take action and fail and learn from that than just plan. I've also been saying a lot lately that perfection is the enemy of good.
Yes.
Right? It feels that way too with this stuff. Yeah.
Yeah, perfection is definitely the enemy of good when you're looking at that. And a plan that's executed that's only 80% complete is much better than a plan that's 100% complete or a plan that's never done at all.
Yeah, yeah. So that's the rubber meets the road moment is go. Just go. You might never feel comfortable. So know when to go and go.
Progress over perfection.
Yeah, perfect. That's really good. Perfect. So number two, there's a lot of frustration from nurses who feel underpaid, overworked, and under supported by in teams. In terms of training and mentorship, often the frustration is directed toward hospital administration. In your experience, how can we bridge the gap between leadership and frontline staff?
So we talked a little bit about this already, and I think one of the biggest ways to bridge that gap is trust. There's a lot of talk about communication, but I think that, communication's great,
Yeah.
but it does nothing if there's not trust in what you're communicating.
Right.
So it goes back to frontline leaders. They want to be seen. They want to be heard. They want a seat at the table. They want to be part of the solution.
Yeah.
So as you're looking at those plans and you're talking through what are we going to change, hearing from them, working through innovative thoughts and solutions, it might be creative staffing models. It might be completely redoing the way that they're thinking about care, but involve them in the conversations.
Yeah.
Get them, get the nurses at the table, talk to them, and understand that they're a key part of the team. So we have to be working together and with our frontline workers and with the nurses and develop that trust so that we can move on to creating true change.
Yeah.
So it starts with hearing them, being visible, empowering them.
Yeah.
And then when they're sharing everything that's wrong, doing something about it.
Yeah.
When they're talking about the fact that it's taking them 60% of their time to document, or they're spending 40% of their day chasing down people on phones, or there's an issue with transportation where maybe the solution is hiring a transporter. So the RN does not have to focus on taking the patient. There are simple solutions.
Yeah.
But they need to mostly be involved in the conversation. And there is a lot of burnout. There is a lot of stress. And, one of the biggest things I think that we can do is not tolerate an environment or a culture where we permit toxicity, where we permit bullying, where we permit complacency, where we permit complaining, where we can really permit that negative culture to take hold.
Yeah.
Because just think, how excited would you be to work on a unit or even, be a patient on a unit where every single person has a scowl on their face, every single person's unhappy, they don't have the equipment that they need, they don't have the staffing that they need, they don't have the resources that they need, everyone seems overworked, overburdened. And if that's all everyone's feeling, then, perception a lot of times becomes reality.
Yeah.
And so what do we need to do? We need to change the script.
Yeah.
We need to flip what we're focused on, and we cannot tolerate those behaviors or allow that culture to exist, because that's not a championship team.
No, I completely agree. And plus it's not a healing environment, how are people going to get better when there's toxicity, in the air? I mean, I'm a big energy guy. So I don't want any negative energy around me when I'm in a hospital trying to get better. I want positivity. But I mean, if you're a frontline worker and an administrator comes into your world and sort of poo-poos your day, that is going to take something away from their ability to provide patient care. And that, I know it seems simple, but I think that's a big deal. It's happening everywhere if we're honest. And that's such a controllable from an attitude perspective. And if you're a leader, don't cause it at the very least. But if you see it, let's take action. Let's try to figure out a way to work through it.
Absolutely. Right now we're hearing about nursing shortages, and the numbers are staggering.
Yeah, they are.
Depending on, what numbers you look at, it can be anywhere from there's going to be a 20,000 person nursing shortage or 100,000 nursing shortage.
Yeah.
And one of the things that we're really not focused on is how many early careerists and first-year nurses leave our profession and leave healthcare because they don't have the right mentorship, they don't have the right support structure. They're thrown into environments where it's toxic, they're not supported. There's a phrase that, they're eating their young, so to speak. But when that first-year nurse comes off, if they're not provided with the education, the support, the mentoring, and they leave our industry within that first year, and I think the numbers are staggering. I've read something like 1 out of every 3 doesn't stay more than 2 years. we're never going to solve the problem.
Nope.
So we really need to be creative with what structures we put in place to provide those opportunities to mentor and coach and lead. But it all starts with an environment that is positive, that
Yeah.
people want to work. And it goes back to, talking about the providers and things too.
Yeah.
You need to have that, environment where the providers want to work, where the leaders want to run, where everything's working together synergistically. And that is ultimately what nurses need and want.
Yeah, totally. I'm gonna flip the script a little bit here. I want to bring up a topic that is kind of a result of all this, and it's kind of specific. But recently, a U.S. bankruptcy judge approved Prospect Medical Holdings plan to wind down operations at Crozer Health in Delaware County after a failed 18-month effort to find buyers. This case raised major concerns about patient access and emergencies. From your point of view, what went wrong? And what broader lessons can healthcare systems take from this? And then you have kind of, when I talked about this with you at dinner, you knew this case really well. And you actually even sent me an article about this, which was really powerful once I watched it. You mind kind of talking about that?
I'd be happy to. So first of all, Crozer Health and everything that happened at Crozer Chester Medical Center and Taylor Hospital. It's the canary in the coal mine scenario, if you will. But ultimately, the organization had been struggling for several years.
Yeah.
There were a lot of issues, and they were looking for someone to come in and actually rescue the hospital, rescue the organization, and landed on Prospect Medical Company. And I forget what their equity company was, the name of it, but ultimately they landed on, private equity to come in and rescue the hospital in 2016. And they were purchased at a very, very, last price, $300 million, I believe, was what, Chester Crozer Health, Medical Center was actually purchased for.
Okay.
But within a couple years, you can look at the paper trail. Ultimately, resources were taken away. There was a sale leaseback decision that was made. And I'm not sure if you're familiar with the sale leaseback decisions, but for listeners that may not understand what that is within healthcare, within other industries, really is
There.
hospital was struggling. They were having trouble meeting their financial needs, so they sold the real estate, or the holding company that Prospect Medical sold the real estate out from under the hospital. And so now you sell the real estate. The hospital no longer owns the land the hospital is built in, and you lease it back. Well, at the time, I believe that, Crozier ended up closing. They had $1.3 billion of lease money on their balance sheet. So if you think about that, there's inability to ever pay back
Right.
those lease payments. They're not going to ever get out of that debt. And so you are forced to then close because you can't pay the real estate holding company that the hospitals actually lose on. Now, you can do lots of research on this. There are multiple skilled nursing facilities across our country that have been closed because of these decisions. There have been multiple long-term care companies
Right.
that have been closed because of decisions like this, and a lot of hospitals
Yeah.
that have been part of this. And it's not a poor concept, except when it's executed improperly and it's executed purely for profit.
Sure.
So when private equity, is brought in with profits in mind and profit over patients, profit over people,
Yeah.
profit over the quality performance of the hospital, profit over everything else, and extracts out $490 million of money that literally, if you think about it, is funded through federal government dollars for Medicare, Medicaid, taxpayer dollars.
Yeah.
It's lining pockets of individuals that, took out $89 million of equity paybacks. It took out all this. And then ultimately, the hospital closes its doors. You have profound consequences and thousands of employees that are out of work. In Delaware County and the situation they're facing breaks my heart,
Yeah.
because 4 out of their 6 hospitals in that county have closed because of situations like this. So they are now left in a situation where they have 2 hospitals that are operating for over 500,000 people. It's heartbreaking. And the situation that you're referring to was a press conference by Governor Josh Shapiro, who was bringing attention to what can happen when private equity enters into healthcare with the intent to solely take profits out. And, the organization that came in there, they had a commitment to keep the hospital open for a period of at least 10 years. It only lasted 9. And so they filed bankruptcy even before that 10-year mark. But now the hospital sits closed. And during that conference call, a very sad situation happened. Was doing the press conference, and he was speaking in front of the hospital, and a mother pulled up with a baby who had stopped breathing and a daughter in the back that was bawling and crying. And just thinking about it makes me get emotional and gets sad and fired up. But luckily there were paramedics there that were able to rush in and save that baby's life and work to transport that mother and the baby to another hospital about 20 miles away, and also to console the daughter in the back that was crying profusely. But that family did not know the hospital was closed. They took the baby in the car, went to what they thought was the hospital, which was a couple miles from their home, and ultimately found the doors shuttered. And, if we think about what's happening across our country with so many hospitals at risk of closing, so many different companies that are entering in, it's heartbreaking. And there's another scenario closer to my hometown, and we talked about this too, that in 2019, the hospital, Elwood City Hospital, which is, in the Pittsburgh area, it's a smaller hospital than Crozer Health. It's, about 40 beds, employ about 400 people. Was purchased by a company that, was AmeriCorps in 2017. And within 2 years, they were not meeting payroll. And literally, they bounced payroll checks. So that hospital nurses, providers were working at the hospital without getting paid. The state stepped in to shut them down because they weren't able to compensate their employees. They weren't able to, produce surgery. So you can't have an emergency department open if you can't operate. So they didn't have the proper equipment to, do the surgeries. And in 2019, shut the hospital down. And there have not been any repercussions that I'm aware of. There were hearings in 2024, I believe, about, the organization and what happened at Elwood City. But there have not been any ramifications, repercussions, anything that occurred about the fact that, again, a company came in, purchased it, took out all of the resources, extracted out all the value, and shuttered the doors.
So these companies that come in, they deem certain monies as profit, and then they take that from the institution and don't reinvest it back in, leaving so they're just pillaging essentially, right?
Correct.
Okay.
It is private equity, joint venture. So it's just like any other corporation or business, if you think about it. There were investors that invest in a private equity fund. And they use that investment money to purchase Crozer Health, purchase the other hospitals that the holding company, Prospect Medical Holdings actually owned, because there were more hospitals involved throughout the country. Same thing with AmeriCorps. Investors come in, they use that money, purchase the hospitals. So their main intent is to get their investment back plus a certain amount. So then they start to extract out that money and extract that out to pay themselves back from the hospital from what's doing. So this is different than traditional for-profit hospitals. So I don't want to confuse the two, because it's a much different scenario than community health systems. There's, remarkable work and has a lot. So different scenario. But yes, they'll invest the money with the main goal is that they're going to get in their investment dollars back plus a profit within a set amount of time, just like any joint venture, any private equity reaction.
Wow.
But yes, sometimes it comes at pillaging. And, I don't have all of the information or details, but sometimes it involves the selling of equipment that's not being used. Sometimes it involves selling the actual real estate that the organizations are. Now, there is real estate that you can sell that you're not utilizing. But the sell leaseback model is one thing that happens. But
Wow. You're right. I mean, the interests are certainly in conflict, right? When you have fiduciary responsibility to people who have invested, and they, if you look at it purely from that perspective, it makes sense that investors will want to get their money back. I just can't imagine that. It's just hard to fathom. And the results are and we're going to put it on and splice it in here. What we see is people truly affected in a meaningful way
Yes.
and very upset. But it's also interesting that you have politicians that are coming in after the fact who are almost saying, I don't know what I'm supposed to do or how. And I really haven't heard a lot of solutions for this stuff because it's everywhere.
It is everywhere. And I think, one of the, situations that has to occur is there needs to be legislation and changes to prevent it from happening in the first place.
Sure.
So attorney generals that can say no to a transaction that's not at the best interest of the hospital or the healthcare community. But once you get to this point,
Yeah.
it's very difficult to, have a solution to rescue. I believe that in this situation that we're talking about, Penn Medicine stepped up to the table and offered $5 million to help to get the emergency department back up and running to get it. But $5 million in, today's environment's just probably a drop in the bucket of what they would actually need
Sure.
to fund that organization and get an emergency department and Crozer Health up and running. But there needs to be a solution. I think they actually were also talking to Christiana Care in Delaware, trying to find a solution there, but it was so far gone at that point that Christiana Care couldn't take the risk of actually adding it to their balance sheet.
Since we filmed this podcast, Christiana Care won a $50.3 million auction bid to acquire 5 Crozer Health outpatient locations. We've linked more information in the description. Now let's get back to the podcast.
And there are questions early on that stop organizations from draining every single resource out, of the hospital. So there need to definitely be different things in place, because when the right, values are in place with lenders and investors, there are a lot of great joint venture and private equity that also are in healthcare to do the right thing. We need a way to keep the, I want to say the shady
Right. I understand. Yeah.
expectations out.
Well, it's like, it's not an easy fix. I'm not naive to think that it's going to be easy to fix this stuff, but there are success models. I mean, we talked earlier about the importance of not siloing it within your hospital, but I think it kind of, if you sort of pull out and you look at it from a more macro perspective, like, let's not silo the things that are working within other healthcare organizations. And, I've talked a lot about this over the past couple of days, is the humility necessary to ask for help, and how hard it is for some people, at certain administrative levels that are in positions of influence, to ask for help and put pride and ego aside to get information that they need to, just whatever it may take. I think a lot of these folks are sometimes like me. I feel it over my head sometimes, but I ask for help, and I don't see that a lot.
We're all in over our heads sometimes.
Right.
And asking for help should not be seen as a sign of weakness.
Right.
It should be seen as a sign of strength.
Yeah.
And if you ultimately are committed to the hospital you're serving, the community you're serving, the healthcare organization, the system, and you want to do the right things, and you want that hospital to strive, you want it to thrive, and you want it to be there forever, you need to ask for help, because you want it to be in the best possible commitment, which means you can't keep your head in the sand. You cannot ignore the balance sheet. You cannot run from the problem. You can't hide. It's not going to change if you don't confront it. You don't look for solutions. You don't ask for help, because it goes back to take one small step forward that's going to move you in the right direction. And so if your balance sheet isn't there, your days cash on hand are weak, your compensation ratio is at an unsustainable point, you have a lot of travelers that you're not able to, whatever your issue is, take a step to solve it. Because if you just take one small step moving in the right direction, you're not going to be in the same position a year from now. It goes back to, we were talking on our ride in here about, exercising and making the right decisions and movement and training. You're not going to change your outcome if you don't take that first step and go to the gym.
Exactly.
And sometimes that first step is just getting out of bed in the morning and putting your shoe on and going out, shoes on and going out the door. That might be that first step.
It's a big one.
So look at your finances, understand where you are, acknowledge it, confront it, face it, and then move forward and take a step that's going to move you in that right direction. I know sometimes it feels like you're taking 3 steps forward and 2 steps back, but that's okay. But you need to act.
I totally agree. And we talked about this last night too. The pendulums of energy swinging. Like, as long as there's energy, you have a chance. It's going to swing bad. It's going to swing good. It's just, but keep it swinging, keep that pendulum swinging back and forth. Once you get a little momentum, stuff can happen. You may not get to where you wanted to get to, but you'll get somewhere different than you are, and so it's like, I mean, again, a lot of stuff is cliche. I know it feels that way.
I have a cliche to add to that.
Yeah, please do.
An object at rest will stay at rest.
Right.
Unless you're connected with a force outside of it. So you need to give something energy, movement in order to get it to move.
Well, now we're talking science and like brilliant people, right?
Yeah.
But I mean, it's like that we think that, we're comfortable where we are for some reason, my mom's deathly afraid of change, so, she works with me. And one of the things that we have to work through, again, it's like rubber meet the road issue, is that fear of change, and it's just because there's this perception that she's comfortable where she is and what she knows. And I mean, stop and smell the roses. I mean, all these cliches have come up in my life, and I now understand what they mean, but I don't want to say them either because it's like, it's kind of corny to say, stop and smell the roses. But man, there's a lot of value in that lesson,
There is.
There's a lot of value in these little cliches that I'm just like, wow, epiphany, at this point in my life.
Yeah. Stop and smell the roses means being grateful for where you are. Have gratitude for where your organization's,
Yeah.
operating, having gratitude and smelling the roses and being thankful that you're in the position that you are to lead that organization. But it also means stop to smell the roses. You're present. Can't smell the roses if you're not present.
I know. It's great.
You're never going to get the moment that you're in back again.
Yeah.
So pause.
Yeah.
Enjoy it. We're never going to be on this stage recording this exact podcast again.
I know.
So enjoy the moment, embrace it. Don't fear everything.
Yeah. No, I actually had that thought. I'm not even kidding. This morning, I was walking to my car. Yeah. On the way to I actually went and hit golf balls this morning. That was my thing. It's my way of exercising today. But I thought, I don't want to be scared anymore. I don't want to live in fear anymore. And I know what I meant when I said it to in my internal thoughts, what that meant. I'm tired of walking on eggshells in life because I might make a bad choice or something might be wrong. And I hope that it freed me up a little bit. Like my psyche, I was like, okay, that's good. I don't have to be scared. What am I scared of? But the more things come into your world, as in our positions, it's like there's like, oh, risk here and risk there and risk here. And in the past, not knowing the risks, I did the right things. But now that I know the risks, I'm like letting that weigh me down, and I might not make the right action. Right. So it's real.
There are no shortages of things for us to be afraid of.
Yeah.
But if we operate with faith over fear, it makes all the difference. And if you operate from a position of confidence instead of operating from a position of lack or a position of feeling that you're not effective or doubt, you'll do so much better. So confidence and faith over fear.
Yeah, it makes a big difference in my attitude, because people feed off of me, like we were talking about. Like I get energy just to get it. Like I'm a vessel that energy passes through. But I got to get it from people. Like I draw it from people. I draw it from my world, So who you surround yourself will matter. And then I also think about that with these hospital administrators who are out there. They're doing everything that they can. They're giving their hearts. They're giving every ounce of effort that they've got to get to a result that's better than where they are. I think for them too, it's who are they surrounding themselves with, and is it okay to be vulnerable? Is it okay, to ask for the help like we've talked about? It's a theme. But then, just be around the right people. Don't be around, like you said, the negativity, and, have the people who are positive in your world. It matters at some point.
It does matter. And I want to touch upon something that I see a lot in today's world.
Yeah.
And that's the hesitancy to let go of a negative employee or a poor performer, because you're afraid you're not going to be able to recruit someone else into that position.
Right.
But everyone brings energy to the table. Everyone brings that. And if you get too much of those individuals in an organization, that energy shifts and changes.
Yep.
So a hospital or a healthcare organization has its own energy.
Yeah.
And you can feel it when you walk into the hospital. You can feel whether it's a good place to work, Everyone's happy. They're making eye contact with you. There's a certain
Yeah.
energy. You feel good walking into that space.
Yes.
Or you can walk in and no one makes eye contact. No one welcomes you. No one's there to, for you to ask directions to. Everyone's looking down and there's a different energy or vibe. And if you want to go to somewhere to get care, are you going to go to the place that when you walk in, you feel welcomed, you feel happy, you feel taken care of, you feel part of the family? Are you going to go to the place where when you walk in, it feels like the weight of the world's on your shoulders? The team is upset, everyone's unhappy, and you almost can't breathe.
Wow.
So
So true.
hospitals have energy.
Yes, they do.
And the senior leadership team, the CEOs, the C-suites, they often bear the burden of creating that energy.
Yes, they do.
And so you have to be aware and cognizant of what you're bringing to that table every day and doing the things with your own self-care
Yeah.
so you can take care of your team.
Yep.
Because you cannot lead anyone else
No.
unless you lead yourself first. So like you went out to hit the golf balls to get in the right step.
Yep.
Leaders have to take care of themselves. There's a cliche now that you have to put on your own oxygen mask
All right. Yeah. The plane. Yeah.
on the plane before you put on anyone else's, but it is so true.
Yeah.
You have to take care of yourself before you can take care of others.
Yeah.
And you're responsible for the energy of your organization. And if you do not like the culture of the energy of your organization, it's your responsibility to change it.
Take action. I think that's a great place to end. I really like that. And when I think about if I'm an executive and I could bring you into my world, and I'll say this, it's not a shameless plug. I'm not a douchey sales bag. I'm just salesy douchebag. It's when you're with somebody like Stephanie, it changes your energy. She'll remind you of things without doing it in a way to where it's like, hey, you should be doing this. It's like there's this way about her, the energy. And speaking of that, like that I've taken from getting to know her over the past few days, there's value in that. So when you're wondering, if this might be the right thing to bring somebody in to help you with productivity or whatever your challenge is, she'll help you with anything. It's just this part for me has been lifting over the past couple of days. The first conversation I had with you, I left that conversation lifted. You were curious, you were kind, and you asked questions about me. You genuinely showed interest. And that doesn't happen a lot. So anyway, anybody out there who's a friend of mine, healthcare executives, remember, I did Humans Healthcare to help you. I owe big. I have to pay forward, and bringing people into your world that are good people is part of it. We've had Anne recently. We have Stephanie now. I don't think this will be the last time we talk to her. So just, if you ever get to a place to where you're just needing somebody, it's really easy to go to Stephanie, and I would recommend it.
Thank you very much for that. I'm very available.
Okay.
You can find me on all social media at ALTIUS Healthcare Consulting Group. I respond to my own direct messages and everything. So if you have a question, please reach out. And, at the end of the day, just want to make a difference for every client that we touch.
You will. Yeah. And you'll find her. We'll make sure that you find her. We'll put the information here. She's available. And then also, like, I noticed you put out a post the other day, or you put out a post, and Scott Becker responded to your post. And he's a great man too. I really enjoy him. He's been a great supporter of mine and what we do here. But you made some insightful comments after being at a conference of his, and he doesn't do that all the time. So I thought, man, what a great thing to kind of give you recognition and flowers for what your comments were. But yeah,
Thank you very much. Scott Becker is an amazing man. Becker's Healthcare has made a huge impact. And I honestly cannot imagine a healthcare environment today where we're not all getting our healthcare news from the latest Becker's report that's coming out,
I agree.
or, having that annual conference and the CEO and CFO conference. So amazing things. And yeah, perfect. Thank you. It's been a pleasure.
Thanks, Stephanie.
Thank you, Danny.
Thanks, everybody. Hey, this is your host, Danny Mobley. Thanks for watching Humans of Healthcare. Please subscribe below for more great interviews.